Well, the first question you might have is, so, Ollie, how impairing is this? Because your wife is in the bathroom, just don't be there when she's flossing her teeth. For some reason, what happens with misophonia is it often is associated with specific
I was
people.
just gonna say that.
Uh,
It's interesting.
yeah.
Like, yeah, I noticed that with my patients of mine, and it's interesting you say that, so please elaborate.
Yeah, well, with my patients, it's often a sound of a parent doing something, the sound of a spouse, the sound of a coworker. Sometimes it's
So why
random
do you
people
think
too.
that is? Let's dig this let's take this apart. Why is that?
This is me going by my gut and my
Alright, and
professional
I'm good at chairs, so
experience,
let's do
and
this.
yeah, yeah, yeah. Because we don't have a ton of scientific answers for that stuff because it's not as well studied. I think one is you're more frequently hearing these sounds from someone you're close to and you have frequent contact with. Number two, your relationship with this person is also more emotional. They're not a neutral person. They mean something to you. Number three, I think it's easier for us to become emotional with our families and our close friends than it is with a stranger. So I think you're hearing the sounds more often. You have more of an emotional relationship, so you can have causal explanations. Like you can think someone is doing this intentionally in a way that you might not with a random stranger, and all of this can make you very emotional. I've always been a kid and a grown up now who is sensitive to sounds in largely a good way. Like I love music. Music has a way of focusing me when I need to do work. It incredibly quickly changes the way I feel. I hear sounds in the environment that my wife and daughter don't. My son I think has inherited this, and he hears the exact same sounds I do, which makes me a little worried that he might develop a little misophonia. The two of us will be sitting there and he'll be like, Dada, the airplane. And I'm like, yeah, yeah, I hear the airplane. And then my wife and kids are like, what? Or my wife and daughter are like, what are you talking about? I hear stuff that a lot of people don't. So I've always been sensitive to sounds, and and at some point I developed this misophonia, and we can talk about what I did, but yeah, it became a personal problem for me too.
Well, it's interesting because when you were talking about the people, I was like, I'm thinking on my patients. And it seems like I'm thinking from like what I see in my clinical practice is first of all, a lot of our patients, a lot of our individuals with SM have sensory sensitivities. It's a huge Y of SM.
Yes.
So louder, larger, lots of people environments will shut them down, will cause them to go in. How can they communicate in those settings? So it's about setting up school accommodations and training parents on, going to stores during off time and whatever. There's a million things you can do, right? But what I think happens because of this hypersensitivity and all the things you said, what I see is like there's a lot of parents that aren't meeting their children necessarily where they're at, and their children sense this like sense of expectation. So they're very attuned to their parent, especially the one with the misophonia.
Mm.
Like an example is a little girl I'm working with and her dad. Love him, amazing. He wants to learn, very invested in the treatment and implementing, but he was very critical of her. And so she was very
Mm.
used to whenever he was around wanting to please. So she became so hyper aware of him and his presence and what he was thinking to please him that any sound he made pissed her the heck off. So,
Yeah.
yeah, I mean, I guess I
Yeah.
shouldn't say
Yeah.
that on live podcasts, but the bottom line is it really did. And to the point where she wouldn't eat dinner at the table when dad was there. This is how I saw them when they presented to me. Wouldn't go places with dad alone, wouldn't sit next to him in a movie when the family went out. And it was very directed towards dad. And there's nothing else going on. There was no abuse, God forbid. It was truly this
Mhm.
like issue that was occurring. Couldn't stand when the dad chewed. The chewing was the biggest issue for her and his breathing.
Mhm.
But I kept thinking to myself and then applied it to about, quite a few others. It always seemed to be the hyper aware of wanting to please and the sensitivity with that parent. So because they're so aware of that parent, it's almost like they heard them breathe. So I'm just shooting
Mhm.
from the hip here.
Yeah. There's many pathways into this problem, And I think my own, I wonder if we could go back in time and ask 6-year-old Ali some of these questions. I didn't have a therapist back then. I didn't. Yeah, I certainly did not have a relationship. I have a great relationship with my parents, and I'm fortunate they're still alive. I still have them in my life, but I did not have a relationship where I communicated my distress, and when I was anxious, and when I was uncomfortable, and so who knows if there is a some history of misophonia that goes back way way back into those early years. But I think for kids there are so many pathways into this problem. I think for adults, some adults have experienced this their whole lives, and then some spontaneously develop it, more like I did. But even if you dig deeper there, I was always a kid that was sensitive to sound. So maybe it was only a matter of time. Who knows? I think there's definitely something there, Dr. E. And yeah, I think one thing to remember about kids is, like adults, kids are doing the best they can, and they have a harder time communicating what's happening to them than adults
Yeah,
do.
they don't understand.
They don't understand.
And you have to
Yeah.
meet them where they're at. I mean, one of the biggest messages I give to parents is you can't be one step ahead and you can't be one step behind. You've got to really be where they're at for
Yes.
them to build the trust and understanding with you and to be able to open up so you can, because that concept of look, listen, and learn, our kids tell us everything we need to know. Your spouse tells you
Yeah.
everything you need to know. It's all there, whether it's nonverbal, whether it's verbal. You just got to like be there and observe and understand because it's all there. So it's,
Yeah.
that sound bothers me. It's not, well, it shouldn't bother you. You need to make friends. And I hate those
Yes.
terms. You should, you shouldn't, you need to. It makes my blood curdle because as soon as you start like that with kids, you lose them in the process. Trust is broken, safety's gone, lack of control, shame.
Yeah. Yeah. It's There's a couple of things here that I like to tell parents, and one is, so much of your job as a parent is to kiss the boo-boos. And we it's very easy to do that when you see the injury, when you see the cut, you see the bruise, when the person is bleeding. It's very easy to stop the bleeding, put on a band-aid, give them a hug, kiss the boo-boo, right? It's harder to do that when you don't see the pain, when the pain is emotional, when it's psychological, when it's disgust, when it's anger. It's very hard to kiss the boo-boo, but our job is the same. When we hug and we say, "I'm sorry it hurts. I'm sorry you got hurt." We are validating that you are hurt and I am here. Know that I am here to help you, and I'm going to soothe you. I'm going to love you. We need to do the same thing with selective mutism. We need to do the same thing with misophonia.